Hi, I'm Cameron and I'll be doing a nasogastric tube placement. Hi, Mr. Dinerman. I'm here to do an NG placement. I checked your orders and we're doing it to help relieve pressure in your stomach from your obstruction. So I'm going to do hand hygiene. Okay, can you give me your name and date of birth, please? Okay, that matches the system. Good. Okay, I'm just going to bring your bed up here to working level. We'll also put you in a high Fowler's position. If not, we can do 45-degree angles for those who have a hard time with staying in upright positions for a long period of time. Okay, so we're doing this to help with your small bowel obstruction. It'll relieve some pressure and pain and discomfort. Now this procedure is very uncomfortable. You may gag, feel nauseous, tear up, cough. So we'll try to get this done as fast as possible so you're not as uncomfortable. I'll hold this down for a second for measuring it. I'm gonna get my tape set up first so it's ready. Here's your MSS basket and tissues for when we do the procedure if you need them. Okay, so to measure this, we'll go from edge of the... Actually, can you put a finger on one nostril, blow it, breathe in and out, and then do it on the other side? Okay, which nostril do you breathe best out of? Right one? Okay, so we'll be placing it in the right nostril. So we measure from the edge of the nostril to the ear down to the xiphoid process. And then from there, we'd add any additional, like centimeters or whatnot. That's hospital policy. I will mark this with my marker. Okay. You've got to lube 2 to 4 inches just to help with entry. Make it more comfortable for the patient. Now while I do this procedure, I'm going to ask you to please try not to grab the tube. I know it's going to be super uncomfortable, but we don't want to cause any more trauma to the area. You may have slight blood that will appear because And I'm just going to set this in the emesis basket just in case we hit the gastric juices and it comes spilling right out. Okay, if you can tilt your head back all the way in, back for me. Okay, I'm going to start placement. I'm going to go along the base of the nasal. Okay, so we're right about where the pharynx is. Okay, I'm going to have you tilt your head down for me. They would tilt this down in real life. I can't really get the mannequins head down. So as they swallow, I would advance it, stop when they breathe, advance it, stop while they breathe, until I get to my mark. Okay. Now if they had started like gagging or coughing or throwing up, we could pause. We could also, if it's real bad, I would take a tongue depressor and a flashlight and check to make sure it's not coiled in the back of the throat, and if so, then I would straighten it out. Also, if they aren't humming, speaking, talking, then we'd want to remove it just because it could be in the lungs. I'm now gonna secure this to the cheek, get radiology to come and check placement. Doesn't stick well to the mannequin, but it would stay there better on a person. Okay, I'm just going to remove these because they are covered in lubricant. Okay, and then I will How are you feeling, okay? I know it's uncomfortable. We can have the doctor get an analgesic spray to help with that afterwards. And we could also have that done beforehand too. Okay, now I'm gonna enter into here, and I pull till I get gastric juice. We'll just say I had to pull to 30. Emesis basket right there. I will take my suction tip, put it there and there, just so it's looped. Okay, set it there. Okay, and then I'm gonna put some gastric juice in there. Pull pH 6, and I can dip it, wait 30 seconds, and then test it to your scale. And it's between 4 and 5, which is good for gastric juice. If not, we wouldn't be in it. Okay, we'll check that. Okay. Now that we've checked and confirmed placement with x-ray and that, we will secure it to the nose. So I would wipe it with alcohol or rag to get any oils, and then put skin prep on, and then I'd put it there, and then I'm gonna crisscross the wrapping just so it's nice and secure. You don't want it to be too tight and up to the nose though. I'll do opposite this one. Okay, and then I'm gonna, okay, can you turn your head for me, please? Thank you. Okay, so this is just so we have enough movement in this for you. So you can turn your head. We're gonna pin this to your gown. Okay, pin to your gown. You know what? I'll do that so it's extra secure. Okay, and then for added security, we can also tape it to the cheek. It probably won't stick to the mannequin, so if it comes off, that is why. Here, we'll wipe the lube off your nose. Okay, and then I'm gonna make sure my suction tubing is where it needs to be, and then come it over. And I don't have a vent for the blue, which is the vent, but I would have one on there. Okay, and we want to keep the air vent above the stove because this is a Salem stove. And then I would turn on, I won't actually turn on because it'll be too loud and you won't hear me, but I would turn it on and then remove the emesis basket. You feeling okay? Any more nausea? No, it's just some irritation. Okay, I would throw this stuff away. Okay, I'm gonna put you in a comfortable position. Your call light is still there for you. Because you are on the pump, you're MPO, and we're not gonna give you water because it'll just suck it right out. Not back, okay. And it is on low intermittent suction. For the suction, you want to make sure it's in the green while it is going. Okay, comfortable as best you can be. I know, we'll get you an analgesic spray. And then every 2 to 4 hours, we will do oral care. So we can use these, go around the mouth, chapstick, and the spray. And, okay, if you have any nausea or the tube is coming unlodged, please alert me with the call light. Don't pull at it, please, because it will just cause havoc. Okay, let me know if you need anything else. And I think that's all. Thank you.